Good afternoon, Dr. Ray. Welcome to another episode of Ingredients for a Better Life. How are you doing today, good doctor?
I'm doing great, Jay. Thanks for asking.
My capsule that was, prescribed for me by you from the Stop and Regrow program based on my biochemical report card and my specific needs. But it's not coming from the pharmacy down the street where you go grocery shopping or the Walmart or whatever. It's coming from this compounding pharmacy. Okay, so my question is like, first of all, what is a compounding pharmacy, and why does Stop and Regrow choose to use it, and we'll go from there.
That's a lot to go through, Jay. So, compounding pharmacies, as you've probably done quite a bit of research into, they can make
Questions?
formulas for you based on individual needs, whereas the manufactured pharmaceutical products have a product that they think will work for certain conditions, and they use certain dosages. With precision medicine, we're not treating conditions, so we're never going to use a manufactured product, right? Because up until the last 15, 20 years, medicines were approved by the government to treat a disease or a condition. And we're not treating a condition or a disease by using a molecule. We're looking at the molecular imbalance that we see inside the body. And
Sure.
then we use a group of molecules to move the molecules back into the favorable, or what we call optimal, ranges. So we're using enzyme regulators to move around molecules, and we precisely inform the patient, such as yourself, what to expect from the next time we repeat the blood work. And as you remember, the molecules all moved into the ranges that we wanted. So we're not
Yep.
treating one molecule or one cellular disease. We're treating an overall biome. And we want, not necessarily do we want the numbers in the right ranges, we want the ratios of certain molecules to be in certain ratios. So there's a lot going on. And for the patient, what they need to know is there's a shipment of supplements that are made and shipped fresh from the pharmacy to them every 3 months. And if we adjust the dosages or the medication at all, it doesn't change you taking, for example, your supplement at the same time. So
Yeah.
you're going to keep up with that same routine, that good routine that you've gotten into.
So it's a specialized precision medicine based upon your individual blood work, and then goes to a special pharmacy to get it made, and then it's drop shipped directly to the client, not off a shelf. It's not the same for Joe or for Pat or for Christian. They're all, each one is different, like two fingerprints.
Uh,
Nothing sitting there on the shelf and we're saying, hey, take this and send it here. It's all customized and drop shipped.
It's customized based on your blood work. And I guess the other difference is there are probably 50,000 or more compounding pharmacies in the United States, but there's really only about 5 or 10 that can do precision medicine the way we're talking about the compounding pharmacies. So a lot of people can mix creams for you, and they'll
Hmm.
mix a lot of creams for women's hormones, estrogen and progesterone and that sort of thing. That's what a lot of the mom and pop types of compounding pharmacies. But to have a pharmacy that can precisely make a zero point 0.1 milligram capsule, put it inside another capsule with 0.7 milligrams, have both of those pHs work at the same time inside the body, it gets a little more layered. And at certain pharmacies, you'll have a set chemist that works with you. You'll have a biologist that works with you. So you have a team that works in some of these larger compounding pharmacies, where the recipes really need to be tailored, as you said, to each individual's blood work.
So there's a big difference between what's happening with the commercial medicines and compound medicines. Huge difference. So, and
Well,
hopefully, eventually, as time goes by, it seems like to me all medicine should be made like this in the future of medicine.
Well, all medicine will that will happen. I think most of the big pharmas are purchasing the compounding pharmacies from the compounding pharmacists because the manufactured that world that paradigm is over. You'll never go to the CVS. Actually, now if you go to CVS and the Walgreens, you'll get more shopping and groceries than you
Sure.
will get pharmacy. So they've got more supplements like vitamin D's and stuff like that. So they've got more of the nonsense grocery types of stuff in those pharmacies today. And
Yep.
the real push is to move into compounding pharmacy, but it's teaching the physicians how to analyze the blood work. And our algorithm, the DNA algorithm, hasn't been out in the marketplace long enough. So
Yep.
it's still difficult to ascertain the ratio of the hormones inside the body without that algorithm.
And another thing to mention as well is a lot of those, medicines of yesterday, people were using finasteride and all that stuff, where Rogaine, these are things that are dependent on alcohol for activation. You know, none of your stuff is, it needs alcohol for activation. It's water-based, it's topical. You use natural preservatives like vitamin C to preserve for shipment and things like that. So, I think that's another point too, that an advantage to a compounding pharmacy versus your local pharmacy is that you're not going to find any of these nasty, preservatives or stabilizers or things you don't want and things that can have harmful effects. Everyone knows alcohol causes a dry scalp. It's not very pleasurable. So, it shouldn't stay away from all that stuff if you can. So I recommend, for me, it's go in, check out that biochemical report card, get the results in, and you'll be surprised what you find. No, nobody's perfect, and it might be something else you need to address, not just the normal sugar, cholesterol. You might have a hormone thing to address, which is very important, as especially if someone's taking something off the rack like a finasteride or a keeps or a Hims. If you don't know which one of these inherited enzymes you're presenting with, because there's a couple of them, and you don't know the range it's at, it could be harmful for your hormones, and that'll put your mood out. That'll put anxiety, weight gain, loss of libido. It could really screw you up, and you don't want to play around with your hormones. So it's why that biochemical report card, I feel, is so important to check in every 3 to 6 months.
Yeah, we had a patient this week came in on the Keeps product, which is really just the finasteride, and chronic anxiety, estrogen was 58. So
Yep,
it was induced. So the anxiety was induced and influenced by the finasteride, which made it worse. So it'll
yep.
take us 60, 90 days just to reverse the damage that was done by taking a medicine without looking at blood work previously. And that happens very commonly. Probably
Yeah.
75, 80% of our patients come in taking those molecules and have anxiety, depression, moodiness, and their estrogens are usually, elevated.
And and as a result, being a chef and looking closely at ingredients, especially with this modern convenience lifestyle, people ordering out, Uber Eats, no time for cooking. It's just work, 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 eat when you can. All the cheaper cooking oils, which makes the job of the cook easier, is adding these oils. A lot of these less expensive oils that these companies and a lot of restaurants are using are soy based. So if your estrogen is elevated, I don't care if you're male or female, and if you're not careful taking in this soy, could be exacerbating the problem.
You're right. Everything matters. So we do a pretty detailed investigative reporting to find out what people are ingesting as far as their dietary daily, what they bring in, and also if they eat out. We do our best to find out what all's coming in, and then the blood work will pretty much lead us into the direction that we
Sure.
need to go.
Yeah, you can't hide from that.
Mhm.
It's all numbers, and there's no hiding, running from the blood work, but it's a good thing. One last thing, Doc, to touch on before I let you go is I understand Stop and Regrow has a new guarantee program happening. If you could just kind of explain what that is, what that guarantee is.
Well, Jay, you'd have to ask marketing. Marketing came to me and said, we'd like to give a guarantee. I said, what a great idea. The program
Yeah.
works every single time. And now they put together a guarantee and they're going to have it out, I think, probably next week.
Okay.
Yeah, we'll find out about it. But
So it's
they
pretty.
started to guarantee that it works, and it always works. You just have to follow the guidelines that we provide.
All right. Well, we'll get more on that when it comes out. Doctor, thank you for your time. Really appreciate you joining me this week, answering these questions, and I'll make sure I get it out to the masses, and we'll answer any questions that we get in the comments and things on social media. So thank you. God bless you, Doctor. Good to see you. Take care of yourself, and we'll talk to you again soon.
You got it. Great to see you. Thank you, Jay.
All right. See you later.